you okay? We'll make a start, Joe. Yeah, okay, thanks. Welcome along, everybody. This is our second session of what we've now called Food and Thought. So there is food at the back, and the thought is going to be provided by our excellent speaker. This is a number of sessions that we're hoping to put on, and this is across the health and social care system. It's not just about the trust, it's about the trust, the CCG, the local authority colleagues here as well. And if you've got other speakers that you think would be really good to get down and come and get an audience together and stimulate some thought for us, please do let us know. We coordinate this through communications. We've got some small seed funding through our charitable fund who've supported this, and I think it would be great to do more of it. So please give some thought to that and let us know who you think we should invite down, and if you've got some with them, even better. It's a delight to welcome back to the island, because I well remember Roy doing one of these sessions many years ago. Demonstrates obviously he's been here too long. Roy Lilley. So just to give you a quick potted history, and I've told him I won't read out the whole of this, and obviously this is only page one of about 8. Roy currently lives in Camberley, Surrey, and he was a businessman with 40 years experience, who started his first enterprise from scratch, built it to a multi-million-pound turnover, and sold it to management partners in 1989. He's now an established independent health policy analyst, writer, broadcaster and commentator on health and social care issues. Twice he's been voted top UK speaker on NHS topics. So we're absolutely up there. You know, we've not started these sessions down here. We're giving you the best. No pressure. No pressure. Roy's experience with the NHS, so some important roles. In the late 80s, he was vice chairman of a health authority in Surrey. He was also a former member of a borough council, and between 1991 and 1995 he was chairman of Homewood NHS Trust in Chertsey, Surrey, which was recognised as a very innovative organisation. They were a first wave NHS trust that was a provider of learning disability and mental health, and amongst other things they were the only health provider in the world to achieve British Standard 5750 for the whole of their services. Achieved the Investors in People Award, and was the only NHS establishment to have a no-strike deal with its staff. So just give you some of the examples which I know Roy was very influential on the team he worked with. He's the author of over 20 books on health and health service management. Many of us regularly read his column on nhsmanagers.net and enjoy his commentary on the NHS from a certain angle. He's also Freeman of the City of London, Fellow of the Institute of Directors and Fellow of the Royal Society of Arts. And interesting, he's a guitarist and magician as well, and started ballroom dancing in 2005, so anything might happen. He's promised to take some of your questions as well, but I'm delighted, and please welcome Roy Lilley.
Thank you very much, and as I say, it's nice to be back. It's very interesting that you're trying to line up some more speakers. I was at I went and spoke at an event last year, and the guy said to me, when I finished speaking, the organiser said to me, we'd like you to pay you a fee, and I said, no, I don't want a fee for speaking. It's been a great privilege to come and talk. And he said, no, he said, we'd like to pay you a fee. I said, well, look, how much is it? And he said, well, it's £10. I said, well, I tell you, why don't you, have you got a charity, or you know, an objective you could put it to? Why don't you put the £10? He said, well, actually we do. We are trying to save up. I said, what for? He said, well, we're trying to save up to get some decent speakers. I'm very nervous about speaking this morning because, or this afternoon I suppose it is, because you're an audience of such experts here. And there's a wonderful story about Albert Einstein, an expert. Einstein, of course, was responsible for the theory of relativity, E equals mc squared. And when he came up with the theory of relativity, it was in the 1920s. The media was nowhere near as prescient as it is today. There was no television, very little radio. There was just the newspapers, and ordinary people didn't read newspapers then. And so he used to give talks, mainly on university campuses, about his theory, and that was the way he kind of evangelized what he was thinking about. And he got invited to go to America, where he was even less known, to do a tour speaking to her across the United States. And he was driven by car from location to location. So he'd go to Newtown every day, speak at the university in the evening, stay in a hotel and move on. And he got halfway across America and he said to his chauffeur, he said, I bet you're fed up with listening to me make the same speech every night. And the chauffeur said, well, no. He said, I'm not fed up with it. He said, but I probably know it as well as you do. So Einstein said, well, look, I'm fed up with it. Why don't we change places? You give the speech, I'll drive the car. So he said, okay. So Einstein put on the chauffeur's uniform and they drove to the next location. No one knew what Einstein looked like, so the chauffeur was accepted as Einstein. And Einstein's chauffeur stood up at the lectern and delivered Einstein's speech on the theory of relativity absolutely flawlessly. And it was all going terribly well until the end, when question time came along. And somebody stood up at the back and asked some god-awful question about the weight of matter. And Einstein's chauffeur, dressed masquerading as Einstein, was unfazed by the question. In fact, he rounded on the questioner and said, I can't believe, having listened to my erudite lecture, that you would ask such a stupid question. He said, why, even my chauffeur knows the answer. Today, Loretta is my chauffeur.
Quite literally.
Right, well look, what am I going to talk about? I have absolutely no idea. I've been knocked out. I've had a fantastic morning, and thank you so much for opening your doors and your minds for me. Because it's a great benefit to me and the stuff that I write. Who reads my stuff? Who reads NHS Money? Oh my God, well, you can come and do this. You know what I think. You don't need to ask me what I think. I think we're all going to hell in a handcart. I mean, that's all I can say. I mean, this is the most dangerous word, isn't it, that we're dealing with now, change. You get people like me turn up and make speeches like this, and they all stand on the stage like this, and they all say, the NHS has to change. The NHS has to change. And they're all frightfully posh, and NHS England and all that, you know, NHS has to change. And I don't know if you notice the body language when they do it, but they flex their knees to change. It's called anchoring. And you see people do it all the time. People anchor most about the things that they know least about. So the more they anchor, the less they know. So when they say the NHS has to change, they flex their knees, and that means they haven't got a clue how it's got to change, really. And when they do it, they say the NHS has to change, and they stick their arse out. And it's because they're talking out their arse, really, because they have no idea how the NHS is going to have to change. Because what have we got? I mean, I travel the world. I'm in Belfast tomorrow. I'm in Berlin next week, talking about the NHS. And everybody comes up to me afterwards, and they all say, you know, you're so lucky to have the NHS. And we are lucky to have the NHS. The NHS was the product of very brave politicians who, in post-war Britain, when we had no money and rationing and all the rest of it, they put 4% GDP into starting a health service, the idea of which no one had seen anywhere else in the world. So it was brave politicians that did it. It was a courageous leadership act. And we want to change that. And I'm not so sure. I mean, you know, young or old, rich or poor, whatever's wrong with you will come and scoop you up. You know, whether you're a granny that's collapsed with a UTI or a cocaine addict that's collapsed in in a pub or something, we don't care. We scoop people up, we bring them into hospital, we fix them up, we send them home, we don't judge them. It's free at the point of need, rich or poor, young or old. That's our health service. And I think that's really important, and I think it's really worth hanging on to. So when people say the NHS has to change, I am now grooming audiences, okay? And I'm going to do this today now. This is what we're going to do. When anybody says the NHS has to change, you immediately all shout, how? Okay, so here we go. The NHS has to change. How? It's got to be louder than that, right? The NHS has to change. How? See, now when you get your next speakers coming along, don't tell them that, but they'll all say that the NHS has to change. See, it will frighten them shitless. It will make them think before they speak, because we do have to think before we speak. Now that isn't to say that I don't think the NHS has to be more nimble. There isn't to say we can't learn to do things better or differently, but I don't want to change the basic tenets of the NHS. But we are facing a very difficult time of change. And what I want to do, my first slide, I know this, I'm going to lose half the audience for my first slide because I'm going to talk about the money, okay? And you're all going to sit there and think, oh shit, it'll be a load of graphs and that money, I'm really not interested, I just want to do really great care for people and send them home and fix them up. And I know that. But unless you actually get your head around this next slide, you're not going to be able to do anything, right? So I'm going to make it as easy as I can for you, but I'm going to talk about the money. Is that okay? The answer is yes, Roy. Okay, is that okay?
Yes, Roy.
Okay, the NHS has to change.
How?
That's good. I love it when you fine. So I'm going to do. It's a graph. Anybody here from the finance department? It's the finance director here. It's the finance director. You ready? Sit there, love. You're going to learn something. I think I'll just stay over this side. And this is a graph, okay? Can you do graphs? Yeah? Okay, fine. I'm going to draw a line on the graph. Actually, I've done this just for the finance department. There's a line, okay, that's demand. Now, people in the finance department would tell you that the demand for healthcare is going up at about 4% a year. They are wrong. I'll definitely stay with you. I've just finished chairing a public inquiry into healthcare in London, the People's Inquiry into Healthcare. We reckon that demand for healthcare is growing by about 7%. We've looked at Birmingham and Manchester, they've got similar figures there. Now, I don't know what it is on the island, but I know your demographics really are quite low in some instances, and I think probably the demand it probably exceeds 4%. But the 4% figure is roughly what the Department of Health and NHS England, the carbuncle as we come to call it, that's what they're using as a figure. Now the money has sort of followed it over the years. That should be more of a wiggly line, I know that, but I've simplified it for the finance department. Okay. So the red line's the money. Okay, now we are in this current spending cycle. Now stick with me on this, I'm going to talk Treasury here for a minute, but it is, I promise you it'll be worth it, okay? We're in this current spending cycle between 2010 and 2015. It's soon to run out when the election comes along. Now, the Prime Minister, when he's on the telly, says we have ring-fenced the NHS. It is true. He has ring-fenced the NHS. Unlike our colleagues from local government who've had their budgets cut by about, what, 27%, I think? Hardly noticed it, they have so much money anyway. They've had their budgets cut, they've not been ring-fenced, and you know, hey, they're putting treacle in holes in the road and closing the libraries. So, but we are fortunate. We have actually had some more money, and when the Prime Minister's on the telly and says we've had 12 million over 5 years, you know, actually it works out to 0.1% a year uplift, which is more or less flatline funding, which gives us the thing in the middle called the triangle of doom. Okay? This is the triangle of doom. Now that triangle of doom is worth about 20 billion. So the NHS effectively has had to do 4% more work for flatline funding. The gap in finances is about 20 billion. Now I'm going to get on to why this is important in a minute. The 20 billion is neither here nor there, to be honest. The 20 billion, well, will we be able at the end of the financial year 2015, are we going to be able to say, do you know what, we've saved 20 billion? Well, I tell you now, the Department of Health press release will say they have. And we've done that. How have we done that? Well, we've done it by sacking 30,000 managers, but you can't sack them twice. We've got about 20,000 nurse vacancies held open. You can't do that twice. We've taken quite a chunk of money out of the tariff, and this is the biggest fallacy of all, we've not given frontline staff in the NHS a pay rise for 4 years. But by not giving somebody a pay rise doesn't mean to say you save the money. Not giving somebody something is not saving it. So there's a kind of, you know, a sleight of hand going on in finance departments up and down the country. And I always have a question. When I was running a hospital, someone used to come and say, we've saved whatever. I always say, can I hear the money rattling in the tin? And you can't. Under most circumstances, you can't. But we'll get ourselves out of jail with this. We've done everything we can. We turn all the lights off in the lavatories. We use both sides of a piece of bog roll. You know, we've done everything we can. And we've been very lucky with the pharmacy budget as well. When you say, no, you haven't got a bog roll. You haven't got a bog roll. Oh, you have to bring your own bog roll. Bring your own device, bring your own bog roll. And we've been lucky with any pharmacy people here. We've been lucky with some of the some of the very expensive drugs have come off patent. So we've been able to buy drugs at a discount. So they'll bullshit their way around this. And then, you know, we'll say, yeah, we saved 20 billion. Now, because you are a very intelligent, erudite, good-looking audience, I know that there is a question on the tip of your tongue that you want to ask me. I'll just say hi. I'm going to ask you. Right, so I'm going to ask a member of the audience at random the question that is burning on the tip of their tongue, which is, who are you?
Tracy.
Tracy, correct. You know your name. That's good. Well done. You've got a major prize. What's the question on burning on the tip of your tongue?
What's going to happen after 2015?
Round of applause. Yeah, I think you're with the CCG, aren't you? Yeah. It's an overwhelming smell of fermenting money. Well, exactly what happens after 2015, Tracy, I haven't got a clue. Okay, but let's see if we can kind of figure out some of this. Well, look. Unless we go fracking in your backyard and find some oil, you might be a bit of fracking in your back garden, I don't know, but you know, we might be lucky. Or we might find a diamond mine in Milton Keynes or something. I don't think the economy is going to pick up that much, and the worry is it looks like the euro economy, the EU economy is not doing too well either, and that's our biggest market, so it is important to us. Now I know this is all terribly arcane and very boring, but it is, you know, it's the kind of thing that we need to think about. So what happens after 2015? Well, if they give us twice what they're giving us now, well, you know, maybe we'll get that much. But the issue here is, what happens? We've got an election coming up now, haven't we? And the difficulty is, what we all know is the NHS needs some more money. It needs about tax and income tax. Because the NHS, if you look at our percentage of GDP that we're spending on healthcare here, it's 9.3. If you compare with the Euro 15 average, it's 9.9. So we are behind the European average. So we really should be spending more money on our healthcare to stay in line with the European 15 average. And that's important because there are a lot of countries in the Euro 15 who have experienced the same kind of austerity that we have. It's just they've chosen to spend more money on those services. So what happens? Well, I mean, the politicians, what are they saying? They're saying that most of them are saying, well, we're going to give you £2 billion more a year. Well, £2 billion is enough to keep the NHS running for a week. It ain't going to work. And the difficulty is, if the Labour Party was to say, we're going to put tax on income tax, the Tories would say, aha! Same old Labour, tax and spend, we're going to go down the same road. If the Tories say we're going to put tax on income tax, Labour are going to say, aha! Austerity hasn't worked, they've had to bail out the NHS. So we're in a very difficult political place. And it is interesting to see that, you know, there is no cohesive strategy on the funding of the NHS after 2015. Now, if you look at what happens after 2015, we not only got the triangle of doom, we've got the tetrahedron of death. We've got the big blue bit. Now, the people in the finance department have a technical phrase, so the big blue bit, and the technical phrase is, oh shit. Because no one has got a clue what's going on. I haven't got a beep machine for the video. No one's got a clue what we're going to do about this bit here, because we know this bit's worth 20 billion, and this bit, if you add it all together, well, the Nuffield say, the big brains at the Nuffield think tank say the NHS is about 30 billion behind the 8 ball. I was talking to Anita Charlesworth, who made that forecast the other day, and she's saying, you know what, Roy, I'm not so sure. I think taking into account revisions on demand, it might be even 50. So look, this is why I wanted to start off with this slide, because the NHS is in a very perilous place. The politicians will start trying to sort this out, and they'll be saying things like, well, we should have top-ups or co-payments or what have you. You'll pay the hotel costs whilst you're in your hospital. You pay for your board, or you pay to go and see a GP and all the rest of it, all that kind of thing. But what they forget is that you see, if you take your taxes out of your right-hand pocket, and you take your co-payments out of your left-hand pocket, it's still your pair of trousers. You've still got to pay, and your trousers are gross domestic product, GDP. So how do you want to pay? Do you want to pay through your taxes, or do you want to pay through the nose? We haven't kind of dealt with that, but I think after the election, we are highly likely to see some kind of move in those sort of directions. Now, it won't be in the manifestos, because you cannot put anything in the manifesto that changes the NHS radically, because you don't get elected. The problem the Tories have is that David Cameron said there will be no top-down reorganisation of the NHS. He moved in and did it. Now, the man is either a fool or a liar. Either he was completely bamboozled by Andrew Lansley, who did it behind his back, or he knew about it and lied. So the Tories, I don't think the electorate will trust the Tories on the NHS, and as far as Labour is concerned, well, I think they are more trusted on the NHS, but they don't have a cohesive plan, and it seems to me that the only way they're going to get more money into the NHS is to tax people with big houses. And I don't think that's going to work either, because I don't think there are enough big houses to raise the kind of money that we're talking about when we're looking about the tetrahedron of doom. This is really very important, and I've kind of worn this slide out over the last couple of years. I use it wherever I go, because organisations like yours need to be thinking what happens after 2015. There is no political answer, there is no policy answer, we don't know what's going to happen. We do have a thing called the 5-year forward view, which I'll say a bit more about in a moment. But this is really very important. If your organisation isn't thinking about what happens after 2015, you are going to melt after 2015. You've got to be thinking, does this look like flatline funding again? Because the NHS has been hobbled with flatline funding for the last 5 years. If it has another 5 years of flatline funding, it will be crippled. So, what do we do about this? Where does this take us as NHS services? This is very worrying. It's no good sitting down doing a strategic plan for the next few years in the expectation that somehow or other some money is going to come from somewhere. Frankly, I don't think the economy is up to supporting it. And frankly, I don't think the politicians have got the stomach to ask for an increase in taxation, but I think it's going to have to come. And frankly, I don't know what the answer is. All I do know is that organisations like yours have to accept the fact that after 2015, the NHS is going to be a very different place. And what does that mean? Well, look, we've got, haven't we, now a thing called the 5-year forward view. Now, put your hand up if you know what I'm talking about, the 5-year forward view, okay? Right, put your hand if you've read the 5-year forward view. Okay, what's on page 19? Look, it's an interesting document. It's written by the new Chief Executive of the NHS, Simon Stevens, and I'm actually going to try and get hold of Simon and get him to come down and the Isle of Wight and talk to you. And it'd be a real surprise. He'd love to come, I think. If he can, I'm going to ask him to fill it in. Can't promise, but I'll do my best. He's written a document. It's not a strategic plan. It's a view of what the services might look like. A view. Now, he understands the tetrahedron of doom like everybody else does. And what he's saying is, look, we need to reorganise how healthcare is delivered. Not change radically, not change to an insurance-based system and all that other stuff, but we need to start thinking about how we deliver services differently. Now, for some parts of the NHS, it is very, very difficult to do. I'm going to make a bold statement here, and I'm going to say that in all the places that I've visited recently, and I do get around quite a lot, I think the Isle of Wight is probably best placed to try and resolve some of these issues. And I'm going to try and explain why. I mean, I'm sure from your side of the desk, you're sitting there thinking, yeah, you should see it from my point of view, Roy. But I just want you to kind of, take a helicopter view, just step away from that for a moment, and let's think about what's going on here. Now, the 5-year forward view, if you haven't read it, read the executive summary. In the executive summary, there are a list of paragraphs. You've only got to read 3 paragraphs, paragraphs 8, paragraphs 9, and paragraphs 10. It talks about what the future of healthcare might look like in those 3 paragraphs. One is an image of multi-specialist teams and organisations working to deliver healthcare. Now, it's multi-specialist, which is the first time that that's been used. What that's talking about is effectively wrapping the services around the specialism, looking differently at how we do it. And let me try and explain what I mean. What was the name of that footballer, Bolton, played for Bolton, had a heart attack in the middle of the pitch? Fabrice Monbo, wasn't it? Do you all know the story of Fabrice Monbo? Yeah. Interesting family backstory. His father was a political refugee, came here from Somalia, I think it was. Fabrice went to school here, got 10 O-levels, 4 A-levels, was a talented footballer, signed for Arsenal, and went on loan, I think, to Bolton. While he was at Bolton, he had a heart attack. Now, if you're going to have a heart attack, let me give you some advice. Pick where you have it. It's quite important. Now, where I live in Camberley in Surrey, and we have a place called the Meadows, which is a big shopping. You know the Meadows? You're nodding, you know the Meadows? Right. We've got a big Marks and Spencer's at Meadows. It's lovely. We all go down there, right? Ladies with lunch. And they've got the new defibrillators, you know, the big yellow things on the wall, right? So if you're going to have a heart attack, it's a good place to have a heart attack. Also, the majority of the female staff that work there are ex-nurses. Because Marks and Spencer's pay more for their staff than we do, and you get a discount on your bra and your knickers. So it's a great, and if you have a heart attack there, you don't like it, you can take it back. But if you're going to have a heart attack, where I live, have a heart attack in the Meadows. He had his heart attack in the middle of a football pitch. He was lucky in the crowd, there was a cardiologist who came to help. He was also lucky that the ambulance was already there, because one of the things you have to do if you're having a big day, you have to have an ambulance present, you have to pay for that. And so the paramedics were there, they came on the pitch, and they took an hour, nearly an hour, to, to resuscitate him. The crowd stood, sat on the edge of their seats, some prayed, they were silent, and eventually he was resuscitated and taken by ambulance. And he was taken out of the ground, and he went past 3 hospitals. They drove past 3 hospitals to a cardiac unit. Wow. He could have gone to A&E, where he'd been messed about by an exhausted junior doctor who's never seen a heart attack before and killed him. But they took him to a cardiac unit. Now that's part of a big reorganisation that was organised by a very talented manager called Dame Ruth Carnell, who you should put on your speaker list, Ruth. I think we should have the Isle of Wight alumni. And she said, look, if you have a heart attack, what should we do? Now what she did was she said, let's start with the patient and work backwards. She didn't say, here's what we do, let's wrap it around the patient and call it patient-centered care. You see people give talks about patient-centered care. If you ever get that, you see the donut thing with a picture of a patient in the middle, don't you, or just a stick man. We're going to put out that there. If you get all that, walk out. I don't know what I'm talking about. Because what we do is, we do what we do and we wrap it around the patients and think we've done a big deal. So, you know, we take your granny who collapses, UTI, blue light, into A&E. We sit there behind some bloke who's fallen off his motorbike or put a pickaxe through his foot or what have you. She waits there for 3 hours and 59 minutes. She's sorted out and we say result. Actually, no, that's not a result. It's a result for us because it means we haven't got to fine 200 quid for overstaying in A&E. But that's not a result. Starting with the patient and work backwards. Starting with someone who's had a heart attack and work backwards. What will we do? Well, somebody who's had a heart attack needs to see a cardiologist like now. So Ruth designed the London Stroke and Cardiac Network, so not all hospitals in London do heart attacks. And that's different here because you've only got one hospital. But the interesting thing about it is that the service is designed not around the patient, but starting with the patient and work backwards. So it's a bit like, you know, your granny goes into A&E and she sits there for 3 hours and 59 minutes. We say it's fine. No, don't take her into A&E. Take her into the geriatric unit where she's seen by a geriatrician in 20 minutes, by social services in 4, and her exit is planned on the day she arrives. You know, that's the way the services are designed. Now, the 5-year forward view talks to that kind of a language, which I think is really interesting. The other bit of it, paragraph 9, talks about, or paragraph 10, I'll come back to 9, paragraph 10 talks about out-of-hours services, and the prospect of all the out-of-hours services being run by the ambulance service. Now that seems to me quite a good idea. And in some parts of the country it's starting to happen. Paragraph 9 is the one I really want to talk to you about. Paragraph 9 talks about vertically integrated care. Now that's where somewhere, like a hospital, is responsible for primary care, community care, social care, and all the rest of it, a whole care package. Someone is in charge of all that. Now that seems to me to make a lot of sense. We've got, you know, health and social care. It's a bit like going into Marks and Spencer's, buying a shirt and having to go down the road and buy a tie. Why aren't these services interrelated? Why aren't they entwined with each other? Well, we know why. It's, you know, it's the politics of it. It's a bit about social services being means tested and health not being means tested. There's a political concern about, would there be a porous boundary between social care and health care, and will we end up having to have services that are means tested in health and all the rest of it. So you kind of have to tiptoe around your handbag, but it's just begging to be done. Now, why I'm optimistic about the Isle of Wight is that you're halfway there already. I've only been here half a day, and I can see you're halfway there. Loretta and her colleagues have shown me around, and okay, tell me, where did I go this morning? What was the first place I went to? Sandown Health Centre, right. I went into Sandown Health Centre, met some GPs and all the rest of it, but I went upstairs and I went to the daily briefing of...
Community rehab team in South Wight.
Right, community rehab team, right. So you've got occupational therapists, you've got some nurses, district nurses, and all the rest of it sitting there. Somebody in the corner, I said, who are you? She said, I'm from social services. I tell you what, I nearly had a heart attack. Social services? You're having a laugh, social services sitting in next door to health people. This never happens, is it? The only way you know you're in social services, you look at the computers, there's Tipex on the screen. I mean, it's... He's going to stab me on the way out. I've never seen that. The only place I've ever seen that was in the Isle of Man. You're halfway there. It's a fantastic initiative. You're talking to each other, you're doing stuff together. Then where did I go to? Where did we see the excellent Lee? What was that called? The Isle Health. Do you all know about Isle Health? Help. Isle Help. It's very hard to say. It's easy for you to say. Isle Help. Right. It's just too clever, isn't it? I know it means I apostrophe help, but it's just too clever. Right, Isle Help. Have you been to Isle Help? Have you been for help in Isle Help? Anybody got problems now? Look, the guy that runs it is Lee, ex-soldier. Takes no prisoners, he's ex-bomb disposal, he said this morning. Right, whatever he says you do. What's happened there? He's got the voluntary sector marshalled. He's got the voluntary sector doing stuff. Now, I've spent a lot of time in the NHS, and anybody here from the voluntary sector? Anybody here from the voluntary sector? No? Okay. One of the big problems with the voluntary sector is the fragility of the voluntary, because they depend on volunteers. And if they can't get volunteers and they don't turn up, you're stuffed. Or they don't get funding, you're stuffed. What you've done there is you've put a wrapper around these fabulously valuable volunteers who really understand stuff. You put a wrapper around it, you've combined their back offices, you've given them some rigour, you've given them a front of house, and they are delivering a fabulous service. 150 people a week are going in there, and you're turning people away, which is an absolute crime. And you've got to sort some money out, Mr. Local Authority. You're not leaving here until you put some more money on the table, because we can't turn 50 people a week away. It's a fantastic service. And so if we are going to have properly integrated services, you are halfway there. You are absolutely what Simon Stevens is envisaging in the 5-year forward view, how services should be working together, vertically integrated. And I just think it's extraordinary that you've kind of done that, because it makes common sense here. You've got the uniqueness of, we've got any local authority councillors here? Yeah, thank you. I mean, you've got a fantastic council here, because you're not really a political council, you're mainly independents, aren't you? Yeah, I know you all fight like ferrets in this.
We're supposed not to be political. Bob might see that differently.
Yeah, well, you're obviously a Tory, so
Simon, that's the first wrong thing you've said today.
Dear, we're all Mrs. Thatchers at heart. Yeah. I mean, you've got a council that isn't riven with the political problems that you have in most councils. I mean, I used to be the leader of my council, it was just a nightmare. But you're not riven with that. You've got elected members who really want to do the best for their electorate, because that's why they're there. They want to end up, they're not there to be on a political run to end up being a candidate somewhere or other. So you've got a unique council. You've got a unique set of opportunities here. You've got a discrete population that you know that you can focus on. You've got a very interesting demographic, and you've got the services that are really, I think, on the brink of lining up. You've got any GPs here? But yeah, if you're a GP, right? I mean, I was talking to some GPs this morning. We were talking about federating and working together. I mean, you have to do that. Somehow or other, you've got to be nudged, pushed, shoved, beaten, bribed. You know, you have got to do that. And if you can pull this off, I think you will be an exemplar for the 5-year forward view. And I think it's within reach. And this morning, I learned that you are making an application to be a vanguard. We're running out of words. It used to be pioneers and whatever it was. We're into vanguards now. I don't know what's happening next. But you've made application to be a vanguard community. That's got to be in by the 9th of February. Don't forget that. Okay, it's down at the finance department. That's down on that. And whose phone is that? Can you tell a lot of people about their ringtone? So you've got I think you've got the makings, you've got the opportunity, and I think you've got what it takes to do it. So I've been really very enthused, and where am I going this afternoon?
You are going to the hub.
The hub,
Yep.
which sounds like more integration.
And then you're going to ED, to look at A&E,
Okay,
and walk in, and
okay.
then on to the wards to have a look at what pharmacy.
Okay, fine, and then that's where I collapse and you have to find me a bed. Right. I mean, I just think, you know, first of all, you all deserve a massive pat on the back for getting this far. And I know when you are, you know, shoulder to the wheel, nose to the grindstone, and the rest of it, it's quite hard to see the wood for the trees, and that's a wonderful mixed metaphor. But it's true, and it is. But I think, you know, of all the communities that I see, I think you could pull this off. I really do think it is. And that then, because, you know, healthcare is about integration, isn't it now? It's about, I mean, people get sick for all kinds of reasons, but for often they get sick for reasons that have nothing to do with health. It's about their jobs, their relationships, what they eat, where they live. All of that ends up at the GP's desk. But the GPs can't sort that out with the help of the voluntary sector. What they can sort out, they can put into hospital, maybe they have to go to hospital. I mean, all of that, I think, is there for you to do. And that's really why I've been enthused. And I wasn't actually going to talk about that. I was going to talk about a lot of other things, and I haven't got time to talk about that now. But I just thought I've got a few minutes. I'll finish at 2:45 if you want to do some questions. Is that okay? Does that suit you? Is that all right?
Yeah, I think we're re-advertised this out, Andy.
Till 1:45.
Oh,
But
okay.
I'm sure we can go.
Okay, right, I'll finish. I just want to talk to you about some people. Anybody recognise who this guy is?
Danny Kay.
Who said Danny Kay?
I did. The Tory boy.
The Tory boy's correct. The Bullingdon Club man is correct. Yeah, that's Danny Kay. Now, the reason I use Danny Kay is I think these people are change makers. I'm going to show you some pictures of people I think are change makers, right? Danny Kay is a change maker, but he isn't. He's a metaphor for a change maker. When I was a little boy, on the wireless, because we used to call it the wireless, there used to be a Saturday request program where you'd write in and have a request that Uncle Mac, who I'm sure is probably a paedophile, but you know, I guess it's too, we'll never find out, but you know, it's a BBC, and God bless you, Uncle Mac. Looking back on Uncle Mac, he's like very dodgy, but he used to do a children's request program, and little Roy Lilley, you know, aged 8, would write in to ask for what was my favourite record at the time. I never ever did get my name mentioned on the radio. Aww.
You made up for it now.
Pardon? What?
You've made up for it now.
Yeah, made up for it, that's true. But Danny Kay used to sing about the Hans Christian Andersen story of the King's New Clothes. You know, the King is all together. And if you don't know the story, the King's New Clothes is all about some shysters who come along and say to the King, here is an invisible suit of clothes that only a wise man can see. A fool can't see it, but a wise man can. And because the King had his head up his arse, he said, yes, of course, it's a wonderful set of clothes. Of course I can see it. Absolutely. And he took his clothes off, put on the invisible suit of clothes, walked down the high street, and everybody was very deferential, said, oh, look at the King's wonderful new suit of clothes. Except one little boy, he said to his mum, Mum, why is the King bollock naked? And you have to be, I think, if you're going to be change makers, you have to be the people that say, why is the King bollock naked? You have to ask the question, why do we do it like this? Now, you may have an answer that's very good. It might well be that you do it like this because it's the best way you can do it. But I tell you, I'm going to go to a lot of other places and say, why do you do it like this? You've got to go to the Isle of Wight and see how they do it. You have to ask the question, why do we do it like this? You have to have that culture within your organisation. You're not bolshy, you're not difficult, you just want to be the best that you can be, and you can only be the best that you can be if you're sure you're doing things right. You have to ask the question, why do we do it like this? You have to ask that question. And it's okay to ask that question. Why do we do it like this? Who's this? Richard Branson, the hairy bugger. I hate it. But I tell you what, has anybody ever flown Virgin upper class? Is it?
Even the trolley boy.
Have you got a rich lover? Do you want one? I don't know how you got on there. Well, I went to speak. I've been actually on it several times, but because generally I go and speak, and it's in my contract. But I was on the first time I went. It's to die for, isn't it? It's absolutely, it's an experience to die for. They send this big stretch limousine, pick you up at the house, you take your baggage, you go through customs, you don't see your bags anymore. You have a glass of shit, champagne all the way. It's fantastic. You're upstairs in upper class drinking champagne, stuffing chocolates, really nice food, watching a movie. And the girl came round and she said, I'm just going to make your bed up, Mr. Lilley, if you like. I said, no, just bring me more chocolates. I'm not going to sleep all the time. This free stuff. Well, eventually, even I had to give up, and I thought, I need to stretch my legs. So I went down the spiral staircase, downstairs, out back, with the poor people. And, gosh, I don't know why you do it. Anyway. At the back of the plane, they're doing the drinks trolley, and I thought, geez, I recognise it. The steward, is that what I think it is? And he said, yeah, it's Richard. He said, whenever he flies with it, he always does the drinks trolley because he likes to ask people what they think of the service. Wow. Wow. Huh? I came back 3 months later. I did a job up in the Midlands. I went up on Virgin trains. Guess who was doing the free newspaper? It's the hairy bloke. He's doing it again. Bugger me. My gym, which used to be Holmes Place, was bought out by Virgin Active. Guess who turned up? On the running machine. Giving it all that. He's stalking me, isn't he? It's obvious, isn't it? I tell you what, he doesn't have to do it, does he? Why does he do it? Because he wants to see what it's like from the customer's point of view. When did you last see a senior manager where you're working out on the front line seeing what it is like? I did a job for a London teaching hospital. I can't tell you which one it is because St Bartholomew's get very upset. Just for the benefit of the table, it wasn't them. And we did a communications exercise, and we got a salami slice of 80 of their staff that was scientifically chosen. And we showed them a photograph of 6 middle-aged men and said, which one is your chief executive? And 72% chose Terry Wogan. They didn't have a clue. If you're interested in this kind of stuff, there's a fantastic book written by a guy called Tom Peters, and he wrote a book called In Pursuit of Excellence, and he talks about management by walking about. And I think, if Richard Branson can do it, we can all do it. All of us have a reason to get out from behind our desks and go and find out what is going on in the services. Here's the Pope, of course, the new Pope. I like the old German Pope first. I think I knew it would be a German. I knew it would be a German when he put the towel over the thing. But here we are. Right, it must be the world's worst job, mustn't it, to be the Pope? I did apply, but anyway. Look, why have I put that? It's to remind me to tell you that when you're changing things and when you're trying to do things differently, you will get things wrong, and it's okay. It's okay. You've got to forgive people who make mistakes. You have to have that culture where we've tried and we didn't get it right, but hey, we've learned and we'll move on. You have to have that culture in an organisation that wants to move forward. Now, you don't want somebody who's making a cock up every 5 minutes, you just show them the door. But when people get things wrong and they come to you, you need the environment where people say, oh, I've done something, and it's a cock up. And that is the time not to say, what, you perk, I can't believe it. The time is to say, listen, thanks for telling me, sit down, tell me what's happened, let's figure out what we can do to sort it out. What's the most important word I just used there? What can we do to sort it out? Their error is yours. It's part of leadership. Leaders are visible, have a vision and share it often. Leaders are visible, have a vision and share it often. And leaders create the time and space for good people to do great things. Leaders create the time and space for good people to do great things. So people will get things wrong. Accept that. Accept the fact that you can learn from them and you can walk and move on. Now, I don't think anyone's going to guess who that is. It's not my best drawing, but it's the best I could do. It's a man called Christian Barnard. Remember Christian Barnard? Yeah? Christian Barnard, in 1968, a man that we'd never heard of, in a place we didn't know where it was, did something we'd never dreamed of. Christian Barnard at the Groote Hospital in South Africa took the heart out of a young girl and put it in the chest of, in the ugly language of the time, a Cape-coloured man. And every vicar and ethicist and tart went on the television saying that this is doctors playing God, and it shouldn't be a girl's heart, a man's body, and black and white. And the whole moral and ethical dilemma was just played out on our television screens when this happened. The guy lived for, I think it was 8 days. It was the first heart transplant that was ever done. When it happened, everybody at Guy's and Thomas and all the rest of it were saying, oh, well, we were going to do it anyway, he just picked us to the post. They hated him. They hated the guy because they didn't know who he was. He wasn't an eminent cardiologist or a cardiac surgeon by any means. No one had ever heard of the Groote Hospital in South Africa. It's called, Groote means big shed hospital. But he did it. And the message is about innovation. Pioneers get arrows in their asses. Pioneers get arrows in their asses. Right? If you're going to do what I think you are capable of doing as a health system on this island, you are going to have to pioneer some things. It is not going to be easy. And you will get some arrows in your asses for doing it. But it takes bravery, it takes courage to move things on. You are on the cusp of doing that here. And I know that there are some sticking points, but it's worth it. The prize in the end will be worth it. It takes courage to move these things on. And this is Alexander Graham Bell. Alexander Graham Bell invented the telephone. And he got nowhere with it here, he was a Scotsman, and he took it to America. And he demonstrated it to the mayor of New York. And the mayor of New York said, Mr. Bell, my daughter Amy has a birthday party this afternoon. And I want you to come and demonstrate your telephone thingy-bob because the children will be fascinated. And Alexander Graham Bell said, this is not a toy, it's a business communication tool. Do you realise, Mr. Mayor, that 20 years from now, you'll be able to lift the phone and speak to someone 5 miles away? And the mayor thought for a moment and he said, I don't know anybody 5 miles. It's about data. It's about technology. It's about talking to those occupational therapists this morning. It's about them walking around with diaries and elastic bands and post-it notes, and there's a thing called an Apple tablet. There's stuff called software that will download where they've got to go. There's software where you can say, I've been to see this person, this is what I've done, and there's something called FaceTime that you can actually ask for help. All of that technology exists over the water. In the mainland, where people like me live. My mum, she's 94, she has an iPad. She loves it, 94. She does email, FaceTime, does her shopping, she downloads porn, she thinks she just loves it, you know. Data. Who's got a Tesco's card? Who's got a Tesco's card? Who's got a Waitrose card? Yeah, I like Tesco's. It keeps the riffraff out of Waitrose. We've got, so you walk around, you've got a card, right? You've got to say you've got a card, Nectar card, yeah?
Yeah.
For like in exchange for them knowing where you live, how old you are, what you buy, when you go shopping, all the stuff that you buy. They give you 10,000 points and a toothbrush, you know. I mean, you're mad to do it, you know, but we all do it, don't we? I did a conference just recently where I presented some data for dunnhumby, the company that does all this. It was another company that used their data. And they said, okay, well, we do the presentation, boy, the data, we can get down to a postcode about people's lives. We can describe their lives. And they said, we'll do a postcode, we'll analyse it, and then, you know, we'll just tell you what it is on the day. So I turn up, I do my presentation, I said, and now we're going to analyse this postcode. And it was there, it was, GU15 3TS. I thought, shit, that's my postcode. What is coming next? They knew everything about me, knew my car, where I insured it, I've been on holiday, my insurances, what I buy, where I buy it, I drink too much, I like strawberry flavoured condoms, you know, they knew everything about me. They had the whole data, and now we're having an argument over care.data and whether or not we should be analysing. I mean, look, come on, we want to know, don't we, who gets ill, what they get ill from, how we fix them up, did it work, and do we want to do it again? We cannot answer those 5 questions, but we have all the data to do it. So I think you've got, and on the island you have a fantastic opportunity. You've got discrete data going back to 1948. You should be crunching that data, because data